क्या आप जानते हैं कि डायबिटीज़ और क्रोनिक किडनी डिजीज़ कैसे एक दूसरे से कनेक्टेड होते हैं? डायबिटीज़ जो आपके बॉडी के ब्लड शुगर लेवल को अफेक्ट करती है, वो आपके किडनीज़ को भी डैमेज कर सकती है। तो अगर आपको डायबिटीज़ है, तो आपका किडनी डैमेज होने के रिस्क भी बढ़ जाते हैं और ये दोनों कंडीशन मिलके आपके हेल्थ पे सीरियस इम्पैक्ट डाल सकती है। तो ये जानते हैं हम आज के एपिसोड से। सो नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल वेयर हेल्थ मीट्स कन्वर्सेशन। आई एम योर होस्ट डॉक्टर चेतना एंड इन टुडेज episode, we will understand that how diabetes impacts your kidney, understand the early signs and symptoms of chronic kidney disease और कैसे हम छोटी छोटी लाइफस्टाइल मॉडिफिकेशन करके इस बड़ी बीमारी से बच सकते हैं. And to simplify this and make us understand this better, joining us today is Dr. Suvrit Jain. He is a renowned endocrinologist practicing at Rohtak and Hisar in Haryana. So let's give him a warm welcome and understand the link between diabetes and chronic kidney disease. So welcome to our show which is Beyond the Pill and thank you so much for coming on our show today और अपना टाइम निकाल के आप यहाँ आए. तो can you just very two-liner introduce yourself and where can people find you?
Okay, so I am Dr. Suvrit Jain. I am an endocrinologist. Endocrinologist means somebody who has done a doctorate in endocrinology.
Okay.
So I am working as a private practitioner since 2020.
Okay.
And I work at two places, Rohtak and Hisar.
All right.
So I am basically serving Rohtak and adjacent areas of Haryana.
Okay. सो इन योर रूटीन प्रैक्टिस आप कितने पेशेंट जैसे देखते हो जिनको ये एंडोक्राइन डिसऑर्डर्स है?
So on an average, I see around 30-40 patients per day. So that would mean somewhere close to 1,000 patients in a month.
So and out of these 1,000 patients, how many are actually diabetic?
So I think the जो एक major chunk है वो diabetics है, diabetic population है. You can say around 70% of the patients are diabetic.
Okay.
So 7 out of 10 are diabetic.
Okay. So why do you think कि इंडिया में डायबिटीज़ इतना prevalent है?
So diabetes is a lifestyle disease. So with growing obesity, sedentary lifestyle, people opting for less and less physical activity and more of cars and other means of transport. The dietary habits which have gone
Yes,
very bad,
yes,
lots of
true,
junk
that's
food.
That's true.
So all that is, and the explosion of the epidemic of obesity,
Yes.
all that has contributed to the very steep rise in
Diabetes
cases.
Okay.
And I think we are just behind China in the number of cases, and there is a projection that will in some time cross China also.
That's not a very good news actually.
Yeah.
So and then today's our topic is about how due to diabetes our kidneys get affected. So for the start to understand what is the exact connection between chronic kidney disorder and diabetes, I feel that let's start with what exactly is diabetes and how does it affect our kidney.
So diabetes, in plain and simple words, is increased blood sugar levels.
Yes.
So the cutoff for labeling a person as diabetic is fasting blood sugar of more than 126, 2-hour postprandial glucose of more than 200, and HbA1c of more than 6.5.
Okay.
Or random blood glucose of more than 200 with symptoms. So this is the way we define diabetes. So increase in blood sugar is diabetes. So when diabetes gets prolonged over a long period, say 10 years, 15 years, so this high blood sugar, it starts accumulating, the products start accumulating in the glomerular apparatus of the kidney,
Okay.
which is the filtering unit.
Yes.
And ultimately that results in damage and damage to the nephrons and leading to impaired kidney function and resulting in what is we call as diabetic nephropathy or diabetic CKD.
Understood. सो आपके प्रैक्टिस में आपने कितने पेशेंट ऐसे देखे जो डायबिटीज़ के साथ साथ सीकेडी लेकर आए हैं?
I think we cannot count the number, the burden and the is so huge. So we can say around somewhere close to 30% of the diabetic population in varying degrees, some more, some less, are affected by diabetic nephropathy. So they, around one third of the patients, they have their kidneys affected
Okay,
due to
understood.
diabetes.
So is it that कि जो भी diabetic patient है will eventually end up into CKD or chronic kidney
So
disease?
I don't think we can say this, but somebody who is uncontrolled, जिसका शुगर कंट्रोल नहीं है और जिसकी डायबिटीज़ बहुत लंबे समय से अनकंट्रोल चल रही है और जिसको एक जेनेटिक प्रीडिस्पोजिशन है किडनीज ख़राब होने के लिए, सो ऑल दीज फैक्टर्स जिन पेशेंट्स में प्रेजेंट हैं उनको डायबिटिक नेफ्रोपैथी हो जाएगी. सो लॉन्ग स्टैंडिंग डिजीज़, uncontrolled diabetes, and some genetic predisposition.
Okay.
If 3 or 4 factors combine together, then that patient of diabetes is likely to be affected. His kidneys or his or her kidneys are likely to be affected.
So anyone who's got diabetes, उसके ऐसे क्या symptoms body show करेगी जिससे उसको ये पता चले कि I might be having some kidney issues going on?
So that is something which is very crucial to understand, that symptoms appear only when the disease is very advanced.
Okay.
So in the early stage, there are no symptoms. So for us we have to give out this message to the people that we have to keep getting tested for our kidney functions periodically, because symptoms only appear when बहुत सारी किडनी जब खराब हो जाती है तभी सिम्टम्स आते हैं.
Okay.
सो अर्ली स्टेजेस में तो सिर्फ टेस्टिंग पे ही
Understood.
पता चल सकता है.
So for this I feel that ये समझना important है कि what is acute kidney dysfunction versus what is chronic kidney disorder.
So acute kidney disease is disease where there is acute decline in glomerular filtration or kidney function, acute dip in kidney function, and the cutoff which we take is around less than 2 weeks.
Okay, so acute means
Less than 2 weeks.
Okay.
And chronic we label as a duration of at least 12 weeks.
Okay.
So impaired glomerular function spanning over a period of 12 weeks is we term as
Okay.
chronic.
Okay. So anyone who's recently being diagnosed with diabetes should also get their kidney
Yeah, we
function
never
test
know
done.
whether, as I told, that symptoms like frothy urine or leg edema, swelling of the legs, or nausea, vomiting, they only appear when the kidneys are very significantly damaged. So in any newly diagnosed diabetic can have some form of kidney involvement,
Okay.
which can be picked up on testing. So any newly diagnosed diabetic can also have kidney involvement. So all patients should be screened for kidney disease irrespective of the duration of the disease, because we never know whether the patient was previously diabetic,
Right.
whether he got tested or not.
Understood.
So
Okay.
testing for diabetes, for diabetic kidney disease should be must at even at the starting of the disease.
So what are the tests which are been available?
So commonly we do a blood test which is very commonly called as serum creatinine levels.
Okay.
So serum creatinine levels, that is something which is very easily done and very cost friendly, so very inexpensive. The more sensitive test जो जल्दी पकड़ सकता है डायबिटिक किडनी डिजीज को, वो है यूरिन माइक्रोएल्ब्यूमिन.
Oh yes. Okay.
So that is a urinary test which picks up protein in the urine.
Okay.
So kidneys start leaking protein earlier than the rise in creatinine. So somebody can have just protein leakage and his creatinine can be normal for a long time, and only after say a significant time his creatinine rises. So we routinely do microalbumin, urine microalbumin test for all our patients with diabetes, so that we can pick up any form of diabetic kidney disease.
Understood. So people really have this myth कि डायबिटीज़ का जो मेडिकेशन है उसके वजह से किडनी डैमेज हो रही है.
This is a big myth. So I think this myth arose from the fact that many patients of diabetes who are taking their medications, they are poorly controlled, and during the course of the disease they develop kidney involvement, and somehow they link that kidney involvement to their
Yes.
medications,
Yes.
rather than acknowledging the fact that it is the disease, uncontrolled blood sugars which are
Understood.
causing their kidney damage,
Actually.
not the medications.
Correct.
So they link up their medications and think that these medications are responsible for their kidney damage, whereas in true sense it is their uncontrolled sugar levels which are responsible
right.
for. So we are all the diabetic medications, none of them is damaging to the kidneys.
Okay. So who are at risk of getting chronic kidney disease?
So I think, as I told, people who are long standing diabetes, more than 10 years.
Even if they are taking their medications
Yeah,
on time.
so we never know their control. And then there are people who have family history of diabetic nephropathy.
Okay, understood.
So it gets clustered in families. So there will be families where diabetic nephropathy is happening more frequently. Then people who already have involvement of eyes, they are much more likely to be having diabetic kidney disease.
Okay.
And poorly controlled diabetes is another risk factor. Smoking is another risk factor. So smoking, long duration of diabetes, old age, family history,
Okay.
and genetic predisposition. So all these factors we must screen. But even in low risk patients we must screen, because it is such a vital organ to save.
Correct, correct.
Yeah.
So, usually diabetes has two types. I mean, more than two types, but then two common types which we see is type 1 and type 2. So, in both the cases, do we see this chronic kidney disease?
Yeah. Both diabetic nephropathy is seen in both type 1 and type 2 diabetes.
Okay, so both these type are prone to getting this
Yeah.
disease. So they both need to really control it well.
Yes.
So when we come to the medical management of it, so what are the treatment options available?
So diabetic nephropathy, it has a very it needs to be very well managed, starting with first of all good blood sugar control. That is the cornerstone. So any patient who has diabetic kidney disease already developed it because of poor control. So now he or she needs to really get hold of his or her sugars. So good glycemic control is the cornerstone for diabetic management. Second is good blood pressure control. So apart from sugars, we should also keep in check of the blood pressures. So blood pressure should also be very well controlled. Apart from that, we need to tell the patient to make important lifestyle changes like weight loss, physical activity, quitting smoking, low salt intake. So all these factors take into account. And then we have specific medications also, which are now well designed to show a reduction in progression of the disease, which prevent the disease from progressing further.
Understood.
So there are now medications, so we can add them also. So this is how we manage diabetic nephropathy.
So if you are taking care of your diabetes properly, if you are maintaining your blood pressure levels also, and doing all the necessary lifestyle modification, can this CKD can be prolonged?
It can be prolonged, and in the early stages it can be reversed also.
Reversed as well, okay.
Yeah. So if it is only mild protein leak, then we can actually reverse it with good blood sugar control, blood pressure control, weight loss, and some medications which have been found to be really effective. So in the early stages, it is even reversible, and definitely we can prolong it, or as you said, control its progression.
So when a patient comes to you and फर्स्ट ही कम्स टू नो कि वो उसको डायबिटीज़ हो गया, देन लेटर ही कम्स टू नो कि अब किडनी डिजीज़ भी हो गया. सो आई थिंक दैट ये बहुत ज़्यादा मेंटल टोल भी लेता है पेशेंट पे. सो हाउ डू यू मैनेज, लाइक what counseling do you do?
It is difficult in the busy OPDs to take care of the mental aspect of it, but definitely we should counsel the patient, and we should give a helping hand, and we should be very supportive to the patients when we tell them that your kidneys are also affected.
Yeah.
So the emotional part, that also needs to be taken care.
But it's not end of the world. Obviously, we have so many advancements
Yeah.
to help you.
Yeah, but some patients, they really do present with the very high creatinine values. So then it is either hemodialysis or they need a transplant.
Okay.
So in those patients, the situation becomes very tough, and they need to really fight it out.
I mean, you need not go there actually. उतना जाने से पहले ही,
Yeah.
I feel necessary lifestyle modifications.
Yeah, recognition of the disease is
Yes,
the
yes.
most important, that this can affect my kidneys. So that is the most important part,
Of course.
that recognition.
That's true. So, and what are the important lifestyle modifications that someone needs to
So
really
physical
take?
activity,
Okay.
weight loss if you are obese, lowering your salt intake, and avoiding smoking and alcohol. These are 4 or 5 very, and avoiding nephrotoxic medications like agents. Some very frequently used pills are like headache pills.
Okay.
So they can really badly affect your kidney. So somebody who has a damaged kidney already, if you give him or her a commonly used headache pills, painkillers, then they can really further increase the creatinine. So these are 4 or 5 lifestyle changes and precautions which we should take while
Okay,
preventing the progression of diabetic kidney disease.
So, any dietary recommendations that patient needs to follow?
So his diet should be full of fruits and fresh vegetables. Salt intake should be reduced, and apart from that, just the normal precautions which one should take while controlling diabetes, avoiding high glycemic index foods, avoiding free carbohydrates, avoiding high sugar items, avoiding high fat diets. All these things need to be avoided.
Then, what about liquid intake?
Liquid intake, I think around 2 to 3 liters of fluids
Okay.
should be good, and unless the patient is having an advanced renal disease,
Okay.
where is bloated and swollen, there should not be any restriction, and we should give plenty of fluids to the patient.
Okay. So, when this patient comes to you in the OPD, like what are the symptoms they get you with, या फिर आप कौन से स्टेज में usually वो patients को treat करते हो?
Commonly, we get the patients diagnosed before they become symptomatic by testing. So they have their urine microalbumin levels raised, or their creatinine values are raised. And once the values are very high, once the protein levels become really high, urine protein becomes really high, or the creatinine levels becomes really high, then they start having bloating, they start having swelling of their legs, they start having poor oral intake, anorexia, nausea, vomiting. So at that stage, it is even difficult for us to manage. But before that, we can, if we are able to get hold, if we are able to catch hold of this diagnosis of diabetic kidney disease, then we can really help out the patient.
So it becomes very challenging actually to know that one of your vital organ is getting damaged because of the diabetes. So how can the family be a support to the patient? या फिर what necessary steps even the family can
So
take to
one major
encourage?
support is you can be a donor to the patient if he or she is in need for transplant. That is something which is very important. Apart from that, emotional help, taking care of the emotional aspect of the disease, and especially helping out the patient with taking their medications, because the patient is on lots of medications. So that part, and acknowledging that the patient is in distress, so taking care of that distress is very important.
And do this medication of diabetes along with medication of kidney disease interact? Like, do they have any side effects? So we have a very short and interactive segment, which is rapid fire, and we have some questions about diabetes and kidney. So I just want you to answer them rapidly.
Right. Thank
Okay.
you.
First one is, can high blood sugar really hurt your kidneys?
The answer is a big yes. High blood sugars, they will produce products which will ultimately accumulate in your kidneys, and they will prevent your kidneys from functioning properly.
Okay.
You will start excreting more protein, and ultimately your filtration of the process is damaged, and ultimately you will become your kidneys will become damaged.
Okay. Second one is drinking lots of water good for kidney health?
I don't think so. It should be optimal. Around 2 to 3 liters is fine, but I don't think drinking too much fluids will help the kidneys. In fact, when the kidneys are damaged, we should tell the patient not to drink too much of fluids, because once your filtration process is compromised, you start accumulating fluids.
Right.
So, yeah.
So the work of the kidney increases
Yeah.
eventually. Okay.
Yeah.
Does everyone with diabetes end up with kidney problem?
No, so everyone is not that unlucky.
Oh, God.
So patients who are very poorly controlled and who have long-standing poorly controlled diabetes, only they are, as we had discussed, only they are
At risk of
at
getting
risk
it.
of
Okay.
getting it, and not everyone gets it. So, yeah.
Can early kidney damage be reversed?
Yes, so as we have already discussed in the podcast, if there is only microalbuminuria, then we have agents like specific agents like RAS inhibitors, SGLT2 inhibitors, and non-selective mineralocorticoid receptor antagonists, which are specific medications which can reverse the microalbumin damage.
Nice. Okay. Is coconut water safe for diabetic kidneys?
So coconut water has a very high glycemic index and produces a very sharp fluctuation in the blood sugar. So uh, as against the common belief, I would suggest it not to be used liberally. People
Understood.
should be very selective in taking coconut water, and large amounts should not be consumed.
Okay. What's worse for kidney, too much sugar or salt?
I think the answer is too much sugar. Too much salt becomes a problem when your kidneys are actually affected by the sugar.
Okay,
So
understood.
once the kidney disease becomes obvious, then probably too much salt becomes more relevant, but too much sugar is the answer.
Can you feel it when your kidneys are damaged?
So very late,
Okay.
only when they are really badly damaged, when you start getting bloating, nausea, vomiting, limb swelling, leg swellings. That is a very late feature.
That is why screening from early on
Screening
is
from
important.
early on should be a rule.
Correct. Okay. Is pain in the lower back always a kidney problem?
So I think pain in the lower back is mostly never a kidney problem.
Okay,
Yeah.
understood.
Yeah, it is usually signifies some muscle disease or some
Understood.
some mostly a muscle sprain.
Problem. Okay. Does controlling sugar keep kidneys safe?
Yes, that is the most key takeaway from this podcast. Keep your sugars tightly controlled so that you can avoid kidney damage.
So last question is, you have to say whether it's a true or a false. You can have kidney damage and feel completely fine.
Yes, that is the, in fact, the difficult part, because you can be completely asymptomatic and your kidneys can be severely damaged. So that is why we need to be more vigilant for
About this.
screening.
Correct. So one valuable advice that you would want to give to our viewers.
Control your sugars tightly. Keep a watch on your kidney functions. Do your serum creatinine and urine microalbumin levels regularly, and show these results to your endocrinologist.
Thank you
you.
so much for joining
Thank
us, sir, today and taking out time from a hectic schedule.
Thank you.
And as well helping us spread awareness on the topic as well. Thanks
Thank
a
you.
lot. तो दोस्तों आज के एपिसोड से हमने ये जाना कि कैसे डायबिटीज और क्रॉनिक किडनी डिजीज एक दूसरे से जुड़े हुए होते हैं और क्यों इसका अर्ली डिटेक्शन एंड प्रॉपर मैनेजमेंट इतना इम्पोर्टेंट होता है. सो टू ऑल आवर लिसनर्स जस्ट रिमेंबर दैट किडनीज आर साइलेंट वर्कर्स. जब तक इसके सिम्टम्स हमें समझ आते हैं तब तक काफी डैमेज हो चुका होता है. सो इफ यू आर अ डायबिटिक पेशेंट, डोंट फॉरगेट टू डू योर किडनी फंक्शन टेस्ट रेगुलरली. सो इफ यू फाइंड आवर वीडियोज इन्फॉर्मेटिव, डोंट फॉरगेट टू सब्सक्राइब टू आवर चैनल and follow us on Instagram at Mankind Specialities for more such valuable health advice on various health topics. Until then, stay informed, stay healthy.